Thank you again. So our next speaker, Gina Lucero, has over 10 years of experience in nursing, and she specializes in cannabinoid therapy. Her business, Boutique Botanicals, has been providing high-quality hemp-derived products to our community since 2014. One of the first, I believe the first, if not. So yes, thank you. So without further ado, Gina Lucero.
Well, hello everybody. Hi, Gina. So as she said, I'm Gina Lucero. I'm the owner of Boutique Botanicals, or co-owner, and I also own Ask a Nurse New Mexico. And they wanted to talk to me wanted me to talk about patient interactions in the CBD industry and what patients are coming in and using CBD products for. So when I started this business back in 2014, it was because I was seeking for alternatives for my health care. I was a nurse working in a hospital. I was diagnosed with early stages of cervical cancer, and I needed alternatives, but I couldn't use cannabis. I couldn't use medical cannabis because I was going to get fired. There was a case that they had just fired a PA at our hospital for using medical cannabis for PTSD. And so I needed to figure out a way to try an alternative remedy. So my son and I started doing some research, and we found that with some of the research that we were finding out of Israel, that CBD was good for slowing down the metastatic side effects of cancer. So my only goal was just to keep the cancer contained so I could have surgery without chemo and radiation. So that's what we did. So we ordered a case of CBD oil back in 2014. Our selections were very limited, and it was very, very expensive. So we started it out, and I took my dad with me. We started out on this journey of CBD. He was a chronic pain patient. He was taking over 19 medications at the time. He had, spinal stenosis and bone degenerative disease. He had been on narcotics since he was 19. So we started him on CBD regimen also, and it was successful for both of us. I was able to have surgery. It was a success. It didn't metastasize anywhere else. Had a full hysterectomy. He was able to get off of some of his medications, and over a year and a half, I was able to get him off of his medications completely. So it changed his life, changed mine. So we thought, well, let's open up a CBD store because people need to know about this. We need to bring this product to our community. So being one of the first CBD stores in Albuquerque, we have all different types of people that come into our store, and they're seeking alternatives to pharmaceuticals. What's happening in the medical industry is that people are losing their autonomy. They're losing their voice and their right to have health care the way that they choose to have it. So a lot of these patients are coming to us seeking alternatives to pharmaceuticals. We have children. Our youngest child that we've treated was 4 months old, and all the way up to 94 and everything in between. We see children with seizures, autism. We see cancer patients. We see Parkinson's, chronic pain. There's a slew of different comorbidities that these people are suffering from, and they're tired of taking pills. So what we were seeing with the industry and me being a registered nurse, I was taking cancer patients over to the dispensaries. And with some of the dispensaries at that time, there was just a lack of education out there. We were taking cancer patients into the dispensaries. The bed tenders didn't really know exactly what to do for the clients or for the patients, and they wouldn't really recommend products that were beneficial. So taking a cancer patient in and having the bud tender recommend, goldfish or cookies or chocolate bars, it just really wasn't what was needed for the patient. So we decided to kind of partner together with Cannahemp at that time to offer some education out to the community. And with that, I think we've come full circle. I mean, we're seeing more and more of the dispensaries educating the patients, educating their employees, and bringing that total wellness full circle. So, but Ask a Nurse New Mexico was created because we're still lacking that consulting aspect. So a lot of patients, our medical cannabis patients, don't have a nurse line to call and say, hey, does this cannabis interact with my blood pressure medication? What are the adverse reactions? If I take too much THC, what's going to happen to me? So we created Ask a Nurse New Mexico. And Ask a Nurse New Mexico is bringing our cannabis nurses. We have 6 cannabis nurses and a medical director, and we're bringing cannabis consulting to the community. So it's the first hotline specifically for cannabis patients and holistic care. So when we're opening up these CBD stores, and now we have CBD stores everywhere. You see CBD everywhere. So we're giving access to these stores, so it kind of takes the heat off of them as medical practitioners. If they don't have a medical degree, they can use Ask a Nurse for these questions that their clients come to. If they have questions about their blood pressure medication and interacting with cannabis, they can give them our card and we can consult with the patient. We also put them on a nutritional plan. We draft up a care plan and give them access to a full regimen, not just with cannabis, but with foods and other supplements that help to bring the whole wellness back to their life. So with CBD products and hemp-derived products, we can help a lot of people. And bringing that education back without a medical cannabis card, it allows people to try cannabis. It's like a stepping stone. So we get a lot of referrals from the oncologist here in New Mexico. They write for their prescription for medical cannabis or their recommendation, and then they send them to our store so they can have like a first introduction into cannabis while they're waiting for their medical cannabis card. So they start them on a high CBD regimen just to get the cannabinoids into their body, and then from there they can wait for their medical cannabis card and they can use the two together. We have a lot of patients that use both hemp-derived CBD products and medical cannabis together because it's a synergistic effect. If you are taking too much THC, you can overcome that adverse reaction by taking high amounts of CBD. And then introducing terpenes. There's tons of benefits to terpenes. So when you incorporate terpenes along with the cannabinoids, you have more of a synergistic effect. So that's what we do. It's been a great 5 years. We've overcome a lot, and we've been able to turn the view of cannabis, I feel, especially with seeing our clients that come into the door, their view of cannabis is changing, and people are really tired of the pharmaceutical route. We're not saying that pharmaceuticals are bad because there's a synergistic effect with some of the opiates, but a lot of people are getting tired of taking handfuls of pills. And that was part of the reason too, when I left the hospital, I was really tired of walking around like I had a Pez dispenser of freaking opiates. Here's your Percocet, here's your Percocet, it's time for your Percocet. And I really had to take a look at it. Is this really what I got into nursing for? Is to push pills down people's throats and not educate them and not try to change their lives? I worked on an orthopedic unit, and we had a lot of patients that were overweight. We had, and I'm not saying I'm the slimmest chick in the room, but we had, patients that were 300, 400 pounds getting knee replacements. But then the only aspect that was missing was nutrition. Like, what are you going to do? Okay, you have brand new knees, and then you have no nutrition plan to help you lose weight, so you keep those new knees in good condition. So, there's a lot of missing information out there in the community when it comes to your health. And really our goal is just to really, if you're looking for holistic relief, to bring back the full regimen from food, whatever you put into your mouth, the type of products, growing clean medicine, making sure that it's free from pesticides, choosing the right foods that are going to help the ailments. Cancer patients need an alkaline diet. There's high chronic patients that have chronic pain disease and they're having a high inflammatory diet. All the stuff that we put into our bodies really affects our overall wellness. So those are the types of clients that we see on a daily basis. And, we have other CBD stores in the room that can attest to this, that people are just tired of popping pills and they really are trying the healthier route. So that's what we do. Ask a Nurse is available to all the dispensaries. The dispensaries can use our service and it doesn't cost them a dime. They can refer patients to us. We can answer those questions. Other stores that are offering CBD products, if they're not health practitioners, we can take that off of your hands by referring those clients to us. We can answer those questions for them. So do you guys have any questions? No? Oh, great. Well, thank you guys for coming and allowing me to speak today. Thank you. Oh, and you have a question?
Yeah, just real quick, is there something that you see more patients for, like in terms of them getting off pills? I mean, obviously opiates is going to be like your biggest thing, but is there something that you guys see more frequently in terms of people who are going to you to get off of other pills?
Yeah, we have chronic pain is the biggest one. Those that are trying to get off of opiates, CBD is great for withdrawing. It's great for alcohol withdrawals, nicotine, opiates, even caffeine. You can go through some pretty gnarly withdrawals just from caffeine. So we see a lot of patients. The majority of our population is chronic pain, and they're just tired of popping those pills on a daily basis. But like I said, they're also looking for a way to titrate off of their medications. Maybe they don't want to give up their narcotics, but they want to find a way to maybe not use as many. And so we are able to help them find a balance there so they can start titrating off of their narcotics with the help of their medical provider. So that's one thing that, if you are in this industry, you don't ever want to tell a customer to just stop taking their medication. They need to follow up with their doctor. One of the other ones really that we see a lot of is with the children is seizures and autism. And those are the ones that we see a lot of when it comes to pediatrics is the seizures, because the seizure medications that these children are taking, the side effects of them are more damaging than they are helping. So we see a lot of children that the parents are trying to get a more holistic approach to seizure control. So, and cannabis doesn't work for everybody. There's a small portion of people in the community that are actually allergic to cannabis. It's a plant, so it's just like any other allergy. There's some people that have an adverse reaction to CBD, just like we have adverse reactions to Benadryl. Some people take Benadryl and they knock them out for 12 hours. Other people will take it and they're climbing the walls. And it's the same thing with CBD. So our endocannabinoid systems all respond differently. But those two ailments, I think, is what we see the most of is seizure control and chronic pain. And then, of course, we get, a lot of cancer patients, but they need the higher THC. They need the medical cannabis card for that, especially if it's metastasizing. So, but we try to guide them in the right direction on that and get their medical cannabis card. Or their oncologists, really, the New Mexico Cancer Center really is, they're huge proponents of cannabis as medicine. So we hardly ever get a cancer patient that doesn't have a doctor that won't sign off on it. So, but those are the types of people that we really see on a daily basis. So, any other questions?
My last question.
Yes.
Do you see a lot more doctors easier to prescribe now?
It's becoming, Yeah, it's becoming more acceptable. Like I said, the cancer support groups, Cancer Support Now, and cancer centers of New Mexico, they're really, I think, the largest group of providers that are writing for medical cannabis cards. So we're seeing that hopefully if we could get all medical providers to just write the card, I mean, it would save our patients so much money, but we still have those providers that just won't. And people are loyal to their doctors, their family physicians. I say if they don't support your decision in cannabis, to find a different doctor. But some people are loyal. You know, the older population, they've had their doctor for 50 or 60 years and they don't want to give it up, so they're willing to pay the money for a medical cannabis card. But I really hope that it changes. I know the VA hospital, they still can't write for medical cannabis cards, and that's really the population that really needs the free access to medical cannabis. So we hope that it starts to change shortly, hopefully by the end of this year. Yes?
Is it actually a doctor prescription, or is it still just a recommendation?
It's still a recommendation. Until the FDA or the DEA releases it off of the Schedule 1, it's still considered a recommendation. But it still has to come from somebody with a DEA license. Yeah. So. Any other questions? No? All righty. Well, thank you very much.
Thank you.